bunion is a misalignment of the great toe. People will often see the lump that the bunion causes, but it's really from the toe and the metatarsal bone being out of alignment. And if we look at our model, you can see that this is a normally aligned metatarsal with a toe. A bunion is where the metatarsal bone moves inward and the big toe moves outward towards the second toe, which gives a misalignment or moves the joint out of position. The bump that you see is nothing but this first metatarsal bone moving inward, and that's the thing that often rubs on the shoe. But where we get into problems is not recognizing that this joint is out of alignment and can lead to arthritis in the future. There's two kinds of bunions. One is congenital, that's the kind that you're born with. Those often will manifest themselves in their teenage years. The second kind is an acquired bunion. That's the kind of foot where you're born with a normal foot. You often put it into a high heel sexy shoe and it gives you a bunion by pushing the toe towards the second toe. The most common symptom of a bunion is noticing the lump on the side of the foot that first interferes with shoe wear. So we have to put our foot into a shoe, and if you have an extra protuberance or lump, then it'll rub on the shoe. But more importantly, as the bunion progresses and the joint becomes more arthritic, people will start to notice pain in the joint, even without shoe wear, and then ultimately the great toe will start to push on the second toe and they'll begin to get second toe pain. Our treatment options for bunions have evolved over time. We used to look at the lump as being painful and that pain being caused by rubbing against the shoe, so our recommendation always was to get wider shoes. The problem is that if your shoes are too narrow, certainly going into a wider shoe helps, but the underlying problem, the misalignment that leads to arthritis, isn't cured by a shoe or a pad or any kind of splint. And so we now believe that once your bunion becomes symptomatic, some achiness to it, then you're better off with early surgical treatment. And surgery is designed to realign the joint, which does two things for you. In the short run, it helps you have a narrower foot, fit into shoes better, but gives you more comfort. But in the long run, it slows down or prevents the formation of the arthritis that we know is inevitable in bunions. We recognize that patients have many options as to where to get their care and many different practitioners they can see for their care. At orthopedic specialists, we specialize just in problems of the foot and ankle and leg. My practice is a large practice that has over 20 years of experience treating just problems with the foot. I've written papers on bunion care. We also believe in a multidisciplinary approach to bunion care, where when you see me in the office, we'll see you along with the pedorthist and the orthotist, people who specialize in orthotic shoes and braces, to try to offer you non-operative care as well as expertise in surgical care.